morning and good afternoon to all of you. Welcome to this webinar on Introduction to Principles and Guidelines for Better Governance in Hospitals. I am Marilu Bradley from the World Bank Institute. As many of you would agree, the healthcare sector faces major challenges resulting in inefficiencies and ineffective delivery of quality healthcare. This is in part manifested by the dissatisfaction of stakeholders, particularly patients. Dissatisfaction among stakeholders in hospital performance signals the need for change. One step at reforming healthcare services delivery is to create autonomous, accountable, and well-governed hospitals capable of taking evidence-based decisions to deliver patient-centered and quality care, while also positively interacting with their complex stakeholder environment. During the next hour, our presenter, Dr. Mostafa Hunter, will share his insights on key principles of good governance for improving healthcare services delivery. The adoption of these principles within the hospital setting has indeed the potential to increase the level of efficiency by which hospitals can deliver healthcare, make decisions, and competitively enhance their overall performance. These principles demonstrate the interlink between several domains. First, corporate and clinical governance. Second, control, edit, and risk frameworks. Third, sustainability and inclusiveness. And fourth, transparency and disclosure. They also indeed highlight the need for a multi-stakeholder approach that allows for fair representation of stakeholders and treatment on equal footing. It is with pleasure that I would like to welcome Dr. Mostafa Hunter. Dr. Mostafa Hunter is the lead founder and chairman of the Egyptian Directors and Governance Association and the Healthcare Governance and Transparency Association. He spearheaded the development of the guide, Principles and Guidelines for Governance Hospitals, from which he will draw insights during this webinar. He is the founder and president of the Health Finance and Investment Forum and a member of the Anti-Corruption Task Force of the Egyptian Junior Business Association, a joint project with the UN Global Compact and Siemens Integrity Initiative. Dr. Hunter is also a visiting professor of the nonprofit Social and International Healthcare Management at the Management Center in Innsbruck. Dr. Hunter is certified in corporate governance by the Egyptian Institute of Directors and the International Finance Corporation. From 2008 to 2010, he served as the lead expert for the health sector of the Egyptian Institute of Directors within the Ministry of Investment to develop programs to strengthen corporate governance of hospitals in Egypt. Although Dr. Hunter began his career as a surgeon, he has over the years proactively worked to support both policy and program development in the health sector. He has international experience in complex multi-stakeholder engagement, management in both the government, civil society, and private business sectors, with a specific focus on investment in healthcare, private sector participation in healthcare, corporate governance, and strategic corporate responsibility. It is indeed, again, my pleasure to welcome Dr. Mostafa Hunter. Thank you very much.
So, good morning, everybody. I'm really pleased to be here with you and just to share this experience that we all happy to have this guide now issued last month and to share this experience about this important topic. Of course, I believe in this topic for really a long period of time now. For 8 years, I've been working on it intensively, and I'm happy that we're just like achieving these steps together. So to start, just like in speaking about this complex topic of governance and bringing governance to the healthcare, we need to understand that there are certain challenges that we're facing all, and I think with whatever nationalities are sitting around the table, we would agree that the healthcare sector is an industry that really has lack of information flow internally and externally. Whether you are a physician, a policymaker, a doctor, or a patient, we all complain that we don't have enough information about the sector, about the public spendings, the private spendings, the prices of the services we're taking. So just if we compare with all other industries, definitely you go to whatever place, you know what is done to you, what is given to you, and who is doing it, and the price of it. In healthcare, we suffer a lot in that, and it's hampering a lot in the decision-making processes and for all stakeholders. We definitely have lack of clarity and delineation between the different responsibilities and roles. We have like mixture on the macro level between the role of the regulators, the role of the providers, the role of the owners. We have like a different problems with the things. We have different problems in so we have like, if you look into that, you'll find like the duties and roles and responsibilities. So for example, between your role as a manager, your role as a physician, your role as a board member, your role as an owner of a hospital or delivery point, your role as a regulator in the Ministry of Health, they're all mixed together. And this overlapping also goes beyond that to the overriding role between the owner of the hospital or the steward or the one that gives direction to the hospital and the executive management of it. Lots of expertise I've seen in different countries also that you have like the decision makers themselves are not empowered in hospitals. Lots of managers complain about these things, that I don't have neither the authorities nor the resources to make a good decision and to respond to the needs of the society and communicate directly, despite the fact that the hospitals are the point of entry and connection to the patients, but really the decision makers there are not empowered to do that. We all suffer from these conflicting rules, regulations, and laws and bylaws. We just like have a web of conflicting rules all over the world and between different organizations. We have this funding problem that is not based on performance and quality of healthcare service delivery or satisfaction of the beneficiary, which is the patient. There are lots of weak credentialing systems for medical workforce, and definitely weak audit and control mechanisms that increases the vulnerability of the corruption of the whole sector. So if we look on that, we'll definitely find that the whole stakeholders, which is a very interesting perspective, when you look on that, you'll find that whether you're a patient, a policymaker, an owner of a hospital, a government representative, a regulatory body, a medical supplier, a pharmaceutical company, a medical staff, employee, an insurance company, you'll find a lot that most of these people are dissatisfied, which is, in a way, some people see it as something negative, but at least there is an opportunity in that, because whenever you find this dissatisfaction of stakeholders, you always find a very great opportunity of reform and changing things to a better thing, because this is the space where you can really have a good space for collective actions. So now what we'll be speaking about today is simply the notion of hospital autonomy, accountability, and in itself how it can be a tool to improve service delivery. So if we look, if you take this trip that I took myself into and walking through it, and I hope I'll keep on walking for the coming years into this pathway to hospital accountability and autonomy. Autonomy attempts to create a self-governed institution that is granted the right to self-determination to run its operation functions. So the first point is very important, that you have the right as a hospital to be granted this. You just have to determine how you spend your money, how to respond to the needs of the society around you, how to respond to the different stakeholders, the employees, the doctors. But it's not only the right, but also you have to be empowered through these things, through the adequate authorities, and more important are the capabilities and resources, because autonomy doesn't reflect only of giving you the rights to take decisions. We all suffer as managers and lots of time, and we suffered into these things of not being capable to, for example, manage our own budget lines, or respond quickly to a need in the society that we see, or that we don't have this money or resources to do that, or to implement our decisions. So it also takes that we need to have these decisions and we have to take them independently, but we have also to effectively and efficiently implement them. Does autonomy mean just like, okay, then I will give you all the freedom and give you the resources to do whatever you want? We can't split it from the word accountability, and it's one of the hottest topics to my opinion, and believe in it. It's with its own level, whether it's hierarchical accountability to the owner, or social accountability, but this is the key word that should shape the health, one of the key words that should shape the healthcare sector over the coming years. And here when we speak about accountability is that a mixture between liability and responsibility. So you have the responsibility to do something, but at the end of the day, you also need to be held liable to these actions. And then you look onto when the decisions, performance of tasks and functions undertaken by the institution are subject to oversight, direction, and request to provide justification. So you have like whatever decision is taken, it is controlled, seen, and justified. So a very important notion in that is that we have to have always bear in mind that a hospital has an owner. Whatever this owner is, a government or the private sector, an NGO, a civil society organization, a cooperative, but at the end of the day, there is someone who put money, invested money, and has the owner right of this hospital, the one that provided the asset and the operational investments. So the owners have the organization, and this organization takes this funding, runs the operation, and creates the service that goes to beneficiary. We really need to look onto these two things, that when thinking of this organization, we want to create on the both sides autonomy and accountability for this organization. First, to the beneficiary, but at the same time to the owner. So if the owner is a private sector, it is for profit, we need to put that in consideration. It's the government has a different agenda, the NGO has a different agenda, but at the end of the day, the organization serves the beneficiary on behalf of the owners. And then we should not forget that there is a wide arena of stakeholders around the hospital, from the suppliers to the different and other patients, the doctors, the nurses, and the relation between all of them with this complex multi-stakeholder arena need to be very well balanced. So, how can we reach autonomy and accountability? What we're speaking about today is that the tool or the pathway is using good corporate institutional governance to do that. And this is what we'll be speaking about today, that we want to use corporate and clinical governance, guidelines and principles, implement them in a hospital to reach autonomy and accountability. If we have an autonomous, accountable organization that's well governed, we should expect this to reflect on the effectiveness of this hospital, its efficiency, its long-term sustainability, and decrease the vulnerability to corruption, which should reflect at the end of the day on better quality of service, lower cost, and satisfied stakeholder, which is the end for all what we are striving for at the end of the day as a hospital. So here we're taking, and that's very crucial point here, just that we're taking a corporate governance approach. A corporate, yes, it comes from the corporate world, from the investment, from the financial community, but at the end of the day, we should not forget that the hospital is a very humanitarian, social organization. But at the end of the day, it's an organization, it's an institution, so bringing the governance principles for institution is important to it. And here we're using the stance of the corporate governance, the OECD definition of it, which refers to the procedures and processes according to which an organization is directed and controlled. So the first important point here is the direction and the control. The corporate governance structure, which is also very important, we speak here on a structural notion for governance that specifies the distribution of rights and responsibilities among the different participants in the organization, whether it's the owner, the board, the managers, shareholders, and other stakeholders, and lays down the rules and procedures for decision making. So at the end of the day, we want to make sure that the structure distributes rights and responsibilities, helps in delivery, taking decisions and delivering them and following up on them. So we came here to the point that we want to have autonomy and accountability. We're taking a corporate governance approach to that, institutional governance. We want to have through this a well-governed, autonomous, accountable hospital that's able to respond to the needs of the community around it and the different complex stakeholder arena around it. And to sum up this, that we're looking onto having a reference point for governance in hospitals to help us reach this objective, which will help us to increase the satisfaction of the stakeholders. So if there is any points at this point, clarifications, you can just post them, any questions, and we'll come back to them at the end before we move now to the second part, which is what brought the need for that and how we reacted to this need. So we reacted to this need by the need to develop such principles and guidelines for governance in hospitals. One important, I'll go quickly through that because you have it in the guide very explained. Just also to highlight in the link, you have the guide online. You can download it both in Arabic and in English language. But I would just like leave a key message here. Whenever you try that in any country, please try to have a systematic approach in the development. We had here like a very intensive exercise, so it was not a book that was written, but rather we had like experts, first and experts, and we brought even experts from outside the healthcare sector mixed with the healthcare sector. We had the desk research process, and then we had the most important thing is like also an intensive stakeholder engagement process from the development, not only post-publishing, but even within the development itself. We had a 360 degrees stakeholder one-on-one interviews and 6 meetings with a diversity of stakeholders all over Egypt. So when we draw onto this experience, it's from Egypt, but it has a global relevance. Whenever you try to go this, multi-stakeholder engagement is a key point. And here you can see a couple of these meetings, and they were all made into interactive. So practically speaking, these people participated even in writing the content, and their inputs were taken into consideration. And even you'll find their names at the end of the guide because they more or less contributed into writing it. So the conceptual framework of the guide was just that we have a corporate governance perspective on healthcare. So this is a very important point. But at the end of the day, we have adaptation to the hospital context. Why we look onto an adaptation to the hospital context? Because otherwise we would have seen, okay, there are corporate governance principles for every country. They function well in the business world. Why let's take them as is? No, we here had a very conceptual clear that the hospital still is a very different organization. It has a very strong social dimension. It's a very responsible industry, so we can't just like take the notions from the business sector and just take them into the healthcare. Then you all also have like different definitions in healthcare. You have like things going around of whether it's a WHO perspective, Tyler's principles. There are different principles covering healthcare. There are clinical governance. All those who worked in quality have reached that, and we try to merge them all together also to bring these perspectives and to merge between what is corporate governance and what is clinical governance and try to bring them into one entity. The same thing was also into a conceptual framework that we have corporate governance perspective and on sustainability. And here we speak about sustainability from the broader perspective, which is taking care of the stakeholder rights, being inclusive to the poor, taking care of the environment. So we can't imagine a hospital that's, for example, there to treat the patients, but still infecting them with hospital-acquired infections like hepatitis C. Spreading of hepatitis C is coming from hospitals. We can't have a hospital that's polluting the community with the waste and still serving the community to treat them. We can't have a hospital that having doctors working in hazardous conditions or nurses to serve the patient. We can't have a hospital that treating the rich persons but leaving the poor. So we have like to take this corporate governance beyond the shareholder values and the owners to the broader stakeholder engagement process. The final thing was that we had these principles unified for public and private hospitals. We didn't segregate between both of them, but rather principles. We were thinking of these principles for all of them. So we didn't have one, it's one guide for both. If you look on the guide, you'll find just like it has 5 domains, which for every domain addressed by the guide, you'll find a principle. For every principle, you'll find the corrective guidelines that are written into step-by-step that help in implementation. And finally, you'll find a bit of samples. Of course, governance, sometimes it's not a one-size-fits-for-all, so whoever uses it can use the guide to develop his own set. But at least there are samples to help you understand how the board charter develops, for example, how a code of conduct looks like. So now we've just had like this, we had like the autonomy and accountability, speaking on corporate governance, and then as an approach, then the need for good corporate governance, then the need for a reference point for governance, and finally a process to develop the guide that was engaging with the stakeholders and did put all the international best practice combined with the local expertise, combined with the expert expertise, and then develop this guide with this conceptual framework that you have now, which addressing these 5 domains that separated, they all intersect, they interlink, but we separated them in this way also to make it easier to understand and implement. So they cross-link in a way, but at the end of the day you have one domain, corporate and clinical governance, one for the board of directors, one for audit, control and risk, one for hospital responsibility, sustainability and inclusiveness, and one for transparency and disclosure. And important to have them all side by side on equal footing. So if you look onto the first principle, which for corporate and clinical governance says that the hospital implements and fosters corporate and clinical governance practices that are both sound and effective. We try to make the principles as guiding notions because at the end of the day we want to have these 5 principles as something that any hospital can pledge to and build a plan and implementation maturity model to finally reach these things. So whenever you look onto corporate defining the structure, we'll not of course go into so much details in that, you have the guides, but at least this principle speaks on 2 important things. The corporate structure or the organizational structure that really defines segregation of duties between the different roles and creates internal accountability and prevents conflict of interest, defines the difference between the owner, defines the difference between the board and the executive management, creates stakeholder representation, and at the end of the day also having a clinical governance that secures the quality of the services provided in the hospital, from credentialing the doctor, having clinical audit, having clinical effectiveness, having research and development, having public and patient involvement in the decision making, having open no blame culture. So the old principles at the end of the day, so the hospital has 2 components, the organizational component and the medical component, and they both need to be well governed. The second principle, we believe that the heart of the hospital is the board, because the board of directors is really the part that sets the direction of the hospital, that protects the owner rights, that balances between the different vested interests of the stakeholders, that creates oversight on the management. So, and to my opinion and experience, boards and hospitals really need rethinking and a lot of work, and to my opinion improving hospital boards would have a very high impact on delivery. So the principle says that the hospital develops its board of directors to be effective, professional and independent in terms of its composition, size and behavior, as well as empowers it to adequately discharge its responsibilities and duties. So we have to think of that the board is a professional position. You're serving as a board member. It's not something that you just like get granted a position to sit there. You're there to do a job. And then this job needs to be very professional, very effective, and the board member need really to be independent from independent objective decisions from the different vested interests around the hospital. We really need to have a functional composition and size and behavior. So we have lots of boards, sometimes they look nice, but they don't meet, they don't do their jobs, they don't do it well. And finally, that the hospital need to empower them to adequately discharge their duties and responsibilities. So they really need to have the resources, the information, enough support, enough authorities to run the hospital, their functions in the hospital. Third is just the hospital. This principle is the audit, control, and risk, and these are 3 very important things. They intersect in lots of things in the hospital, and they reflect a lot on efficiency. Because whenever you have this control mechanisms, you have very streamlining of operations. You have very good independence of an audit process. You have continuous improvement of processes. You have much less fraud. You have less waste of resources. So if you look on these principles, how the budgets, how the control mechanisms, how the auditor functions, how the consultative and assurance activities of the audit, all these things are very important. And of course, risk management is a science, whether it's an organizational risk perspective, which is then the hospital needs to serve. So a hospital is very different than any other service provider. You can't just like, if it fails, you can't close it. It's not a restaurant that you say, okay, we couldn't fulfill, we lost our money, so we will close it, and no problem, the people will go to other restaurants. You have like really to maintain this hospital because it's serving the community. So looking onto organizational risks is very important, but also looking onto patient risks and the interlinking between the organization and financial risks with the clinical risks. So, and then linking all them together, control and audit and risk, should set a very strong framework for us to be able to handle the hospital. The fourth principle, as we said, is just sustainability and responsibility. Here we say that the hospital applies and cultivates responsibility, ethics, and inclusiveness practices, and takes its specific social, ecological, and economic environment into account. And as I said earlier, here it's very important to think of a hospital as a healthcare in general as a industry, humanitarian industry at the end of the day, with a very strong social dimension. But on one side, we should not forget that, again, it's an organization and it should be run financially well and institutionally well, but also it really needs to be socially responsible and ethical. There are very low margin of unethical behavior in healthcare and not acceptable. It's an industry that cannot exist without being inclusive. You can't just say I will serve one group of people and not serve the others. So we really need to put into that, and you really need also to put the social, ecological, and economic environment into account. So the fifth principle goes into that the hospital integrates transparency practices into the core of the organization and commits itself to good disclosure. This is also, as we started earlier, that we have very little free flow of information within hospitals in general. So whether you are an employee, whether you are a manager, whether you are a patient, whether you're a policy maker, you don't have free flow of information. And here I'm not only speaking about transparency from the notion of like available information to the public, I'm even internal transparency. So if you have a board of directors that doesn't have enough information to take a right decision, how can you expect the stewardship role of this board? If you have policymakers who are taking decisions not based on good information, with all the criteria of good information that you'll find in the guide, which is that it's timely, it's in a material, it's in the right time, it's equally accessible to stakeholder, it's in a form and easy to read. So information is not like I give you 300 papers of documents, but in an easy way to help everyone to take the decision. And the word disclosure is that you just like you need to have a disclosure policy. Every hospital needs to define who should know what, when, and in which form. And this should give the rights to the people to, knowledge is a right at the end of the day for the whole arena of the stakeholder. So if you finally look then at the end of the day, you'll find that we have like the 5 domains clustered together into intersecting things, but the belief is that you can't take one and omit the other, but rather this was one thing that evolved with time while developing the guide, is that we wanted to have something that comprehensive, that covers all the principles, covers the thing that this is the well-governed hospital, that it's well-governed, has a strong vigilant board, has a strong audit control mechanism, is responsible and inclusive, and it's transparent and has good disclosure. Of course, it's not something that you decide, I will take it from today till tomorrow. It's a long path. It's a maturity model. People with the time need to, you need really to look onto the connection of these things, how to connect them, which parts to come together. But this is what we believe, that it's a long path, but it's the right path. And if we achieve this, we'll achieve autonomy and accountability. And if we achieve well-governed autonomous accountability hospital, this would reshape a bit in lots of things in the healthcare industry. Finally, because it's not a book, so we're very keen to take it directly into action. It's a guide. It's not an easy process. But one important line, or even if you use it, so it's an experience from Egypt, but I believe it's of a global relevance. Looking into even the content of the guide, it relates to most of countries. So one very important point is the awareness part, and to guide the people in understanding this, And the awareness part, you be very, you need really to put in mind that you should not take a threatening topic like governance in a way that would let the stakeholders shy out, but rather an inclusive approach in awareness that you build this together, because there is a lot, as we started saying, that all stakeholders are dissatisfied. Multi-stakeholder partnerships function very well in such things because there are lots of maybe competing interests, but there are lots of aligned interests and lots of great opportunity for collective action where the win-win-win-win scenario for all the stakeholders is there. So you really need to have a combination of an awareness plus an advocacy and stakeholder engagement plan built on a scientifically and equal representation of stakeholders, and not have a mono-stakeholder approach to such a complex multi-stakeholder thing. Another pillar that's extremely important in capacity building, so we had like lots of awareness sessions, as you've said, even we included the stakeholders within our development plan, and we were, as we went, we evolved with time of what we should be doing. So we had like this capacity building. Now we started capacity building on the guides themselves, and we're starting also to create certifications for auditors, certifications for board members, and certification for executive finance in hospitals to help the people to create the calibers who can run such a framework, not only speak about it. And then finally, we started with a group of hospitals, public and private, and start implementing and documenting the process and building the maturity model, because at the end of the day, we need this experience. And I hope that at one point we can sit here a couple of years later and share experience about hospitals from Egypt, from other hospitals, and build together sort of a maturity model for implementing these guidelines. So this is the summary. We'll then open to hand to Mary Lou again and see how we will run this, the coming, because the most interesting part is coming, is to hear, to look onto your feedbacks and discuss that together.
Thank you, Dr. Hunter, for sharing your insights with us. I think now we will like to open the floor for questions and answers. To kickstart this process, we would like to pose 3 questions, and if participants could provide responses, that would be highly appreciated. After these 3 questions, then we will open the floor for to give Dr. Mostafa a chance to respond to the questions that have been posted so far. So here I think you see in your screen the first question, and we just wait to see what people think.
That's fine. So this question, which is like hospital autonomy alone contribute to, a big chunk of the answers came on all of the above. I would just like to highlight autonomy alone without accountability is, so I would say like the first answer, yes, enhanced ability to effectively respond to the needs, yes. But reduced vulnerability to corruption and increased accountability to the delivery of quality health care, if you don't, autonomy can increase them, but it has a very, if you leave it alone, if you give people the full authorities without creating accountability mechanisms for that, it can lead to increased vulnerability to corruption and can decrease the accountability. So here I would say like the answer is the first one, and the other ones it's not alone, so it's autonomy and accountability. So if the question was autonomy and accountability, it would have been right. Second question.
Then perhaps we go very quickly to the second question.
Of course, agreed. It's all of the. So agreed. It's all of the above. The majority, as the majority says, it's all of the above, and this was the key notion that we had within our development process of the guide. That it's for all public, private, and for non-profit hospital. At the end, every hospital has an owner, and the owner has rights, and the governing structure should support these rights, and principles should apply for all. We can't say that a private hospital would not be accountable and would not be well governed or whatever. So it's all of the above. The principles are made for all of them.
Okay, then we proceed, I think, to the third and final question.
Here he went to. So it's right. Also, it's like the main answer is streamline decision processes. It's important to know that the most important thing of transparency, because we take the notion into exposure in the thing, but rather the most important thing, it helps both parties, stakeholders and the managers and employees and all people to streamline their decisions, which reflects on the efficiency.
Thank you, everyone. Thank you, everyone, for your responses, and thank you, Dr. Mostafa, for elaborating on the responses to this. Now, I would like to open the floor to address the questions that have been posed by participants. There are quite a few that have been addressed, but perhaps what I would like to do is to raise the first three questions and give Dr. Mostafa Hunter a chance to respond. So, Dr. Mostafa, the first question is from the participant is if you could please elaborate further on how autonomy and accountability would improve efficiency. What is your proposed pathway? Shall we start with that and then maybe go to the next?
So of course it's a long time. I can spend 1 hour on all this thing, but shortly, if we imagine, for example, let's take examples of. An example of autonomy and accountability. So imagine a hospital that's empowered with the resources, has its budget, can freely decide on spending these budgets, and can respond, for example, that there is a need for a machine now, so they can decide on which machine they would choose based on their interaction with the stakeholders. It differs a lot when they are just not empowered and not given the capacity to take such a decision because of governmental budget lines that they can't override, or decisions they can't take today, or they need authorization from others. So they can, and they improve their efficiency. Combined with accountability, if you imagine, for example, a manager who is not held accountable for any action, when we have, like most of the cases where you have the board of directors or trustees made by the same executives who are the doctors, who are the managers in the hospital. So of course there is no urge to improve efficiencies. The managers, it's very different, for example, for a manager going to a board, a professional board, which has the power to to guide this manager, the intellectual capacity also to have the oversight and the procedures. This manager will make sure to be always efficient in front of this board. The board will support him with that, but holding the manager accountable to the board automatically gives this thing, and this goes to the whole hierarchies. Or for example, holding the hospital accountable to the patients forces the hospital to make the quality of services better. Offering information helps exposing things helps the people to improve the processes rather than hide things. So it's like if you look into every component of the guide, you'll find that it reflects at the end of the day on this efficiency and process.
Thank you, Dr. Hunter. And perhaps we proceed to the next question, which is really around the issue of political interferences. In some low-income countries and possibly also in middle-income countries, there's perceived political interferences within the public institutions, hospitals included. So what advice can you give to address this case, recognizing that governance and accountability may be very difficult to attain given these interferences?
Of course, we should address that some points there are conflicting decisions when it comes to governance, because but at the end of the day, the one proposition here is that exactly we need these guidelines. Why? Because we really need to split the role of the government in public hospitals as an owner of an asset and provider of the service by representing the taxpayers' money. So we have like these taxpayers' money, the owner represents them in putting that in the hospitals to serve the community, again, who are the taxpayers, or who are paid through an insurance scheme. So this is first definition. So the decisions should be made accordingly, not without a political interference. The second fundamental point that goes beyond hospital framework and goes into the governance of the system is the splitting the role of the government as the owner and service provider and the role of the government as a regulator of the service. So, but at the end of the day, I don't think also that any political system doesn't want to be interacting with its society, and the interaction with the society in healthcare is very important. So the message here is that we need ourselves to dig into this process, that this efficiency and effectiveness would actually help politicians more by offering better services to the community, rather than taking the approach of acting against politicians. That's why I would highlight that to overcome this, you really need to have a multi-stakeholder engagement process that includes the government and political bodies with you in the process from the very beginning, because with time, to my experience, when they get really aware and understand that this has an added value to them, and there are conflicting parts of it, yes, but there are also added value, and then there is always a sort of a business case that you can build that the wins are higher than the cost. But I wouldn't also claim that it's an EG's job to do that.
Thank you, Dr. Hunter. There is another question from participants with a request to please talk about hospital autonomy and the need of an adequate regulatory system and structure. Could you please respond to that question?
Mm-hmm. So, an adequate regulatory body, definitely, and this definitely regulatory body needs to be on two levels. One on the service itself and the other part on the organization. So you really need to have regulation on the service provided, but you need to have regulation on the organization itself and its ownership structure. You really, as I mentioned earlier, need to have a complete segregation of the role, because usually we use the term government and governance just with its broad perspective. We need to define roles and functions. We say here, I'm playing here the role of the owner. I'm playing here the role, for example, of a regulatory body. I'm playing here the role of a patient right advocate. And these roles also need to be defined from one another. The second thing is that regulation is not only the debate, also not only by law. And I don't like the school of turning everything into laws and regulations, because at the end of the day, sometimes laws and regulation turns everything into a form without a substance. But rather, the best regulatory framework to me is creating an environment of accountability. When everyone is accountable, then regulation happens automatically without anything. So whenever even you're putting laws and regulations and bylaws, the whole definition is to make sure the segregation between the duties and responsibilities. So if you have a patient complaint mechanism that goes to the manager of the hospital, then you say this is an accountability as long as it goes only to the manager, who is actually the patient. If the patient complains the manager to himself, then it's not there. So, so this is a very important point to think also of this segregation of duties, and this brings us to the internal control frameworks. So, so the regulation, I would say, just to sum up, you need to have on the micro level a small regulatory framework of accountability within the hospital. And then you need to have an accountability environment that holds everyone accountable. you have to have people, capacities for that, individuals for doing these processes. You have to have the structures that support them. On a macro level, you need also to have the institutional framework that segregates the role of the government as the owner or the provider or the payer or the purchaser or the regulator. These, even they're all governmental, but they need to be different entities from one another so that you can have this accountability. And finally, of course, transparency and the free flow of information is the greatest regulation, because this is what creates the social accountability at the end of the day, and the public regulation.
Dr. Hunter, could you also please share your thoughts about what composition of the board of directors may be most effective for public hospitals?
Okay, this first of all, there is no one size fits for all. So I wouldn't recommend, say, okay, tell you 3, number 6, 7, 8, whatever. But the one, to my experience working in lots of these things, first of all, I wouldn't recommend having completely executive boards. That is to say, in lots of hospitals, you have the board made of the general manager, the assistant manager, the head of the nurses, the head of the doctors, because this is a conflict of interest. You don't have accountability. I wouldn't recommend having only physicians on boards, because the hospital is an organization. It needs finance, regulation, law, so hospitality. So the second thing is I wouldn't recommend that. The third thing, I wouldn't recommend boards of trustees that made of complete only stakeholders, because sometimes it becomes a complete area of vested interest and becomes dysfunctional, and they don't have the qualifications of the board, the needed qualifications. So the key points that you need to put in mind is this composition should be the number that should not be dysfunctional. So I wouldn't recommend more than 11 persons for a hospital. It should have a mixture between executive directors. You have 2 or 3 persons from within the hospital, 2 or 3 persons representing stakeholder interests, and 4 to 5 independent directors who serve by the criteria of dependence on this board. They're not consultants. They're held accountable to the position on the board. They serve with their expertise, and you have to have at least 1 legal, 1 financial within them, hopefully 1 hospitality, and definitely 1 or 2 physicians. So you put these things, and then you use the term right mix of skills. You use the term diversity. Finally, of course, gender diversity is very important, not because a quota of women, but this diversity in the decisions also helps a lot. So, but to reach this, you really need to turn the hospital into an autonomous entity so that this board becomes empowered, and then you have to put the board charter and the things that ensure that this board also would perform right and do it, behave well, because you can't find the best composition of people that never meet.
Thank you, Dr. Hunter. I'd like to ask the participants if there are any other questions that they would like to pose to Dr. Hunter, or perhaps some requests for clarifying any of the points that we have covered during this webinar. There's another one typing. Okay, it seems that there are no further questions from the floor. So with that, I think we will proceed to, close this webinar. I would like to thank all the participants who have joined this webinar. I think from the sets of discussions that have been raised, it shows the importance of the importance of improving governance and accountability in health facilities such as hospitals, but also recognizing that this is not an easy task. This is a task that is quite complex and will take time, but I think at the heart of this is that not only do you change the processes that lend themselves to better governance and accountability, but at the heart of it also is a question of working towards changing mindset such that governance and accountability over time can be improved, which in turn can hopefully lead to improvements in the delivery of healthcare services. Thank you to all the participants that have joined this webinar. I would also like to thank Dr. Mostafa Hunter for sharing his insights and providing some principles on how to improve governance and accountability in service delivery. Before we close, I would just like to inform all participants that this webinar is videoed. A videotape will be available in a few hours in the website. You will be receiving a sort of thank you email providing the link again that you could use to view the video taping of this webinar, as well as access the guide that Dr. Mostafa had authored, and also some other information on this topic. I would also like to request participants before we close, if you could kindly please provide feedback and comments, and I think we will be providing in a few minutes sort of the evaluation form. It's not really an evaluation form, it is really a brief questionnaire to help us learn about your feedback, and perhaps to also get comments on what types of webinar would be most useful for you in the future. So I think that's that. Again, many thanks to everyone who have participated. I'd like to give the final word to Dr. Mostafa before we close.
So before we close, I would just really happy to share this experience. I'm always happy to do that. I'm very passionate about the topic. Just as Marilu said at the beginning, I was an eye surgeon. I stepped out for this and I believe in it. And I hope that the more we will do this work together, the more expertise we share. So whoever would use these things from different countries, please try to share us. Please send email on either HeGTA or try to reach us, because really, or the WBI, because sharing this experience, reaching this collective action, it's a long path, but I guess I'm very optimistic now, seeing also the positive responses from the people. And thank you, Marilu, and thank you, the World Bank Institute, for this opportunity, and hope to sit here 5 years and discuss success stories from all over the world.
Thank you, everyone.